Welcome, everyone, and thank you for joining us. Today, we are talking about brain injuries caused primarily through contact sports. For this conversation, we are very excited to have with us Dr. McKee. Dr. McKee is a distinguished neurologist and neuropathologist renowned for her pioneering research on chronic traumatic encephalopathy, a neurodegenerative disease linked to repetitive head injuries. She's currently the director of the Boston University Alzheimer's Disease Research Center and the Boston University CTE Center. She's the founder of the Unite Brain Bank, which is a tissue repository where traumatic brain injuries and CTE are studied. The bank collects brain and other tissue from deceased athletes and military personnel. Dr. McKee has authored numerous peer-reviewed scientific publications and has been instrumental in identifying and characterizing CTE. Her research also focuses on the neuropathological alterations associated with neurodegenerative diseases such as Alzheimer's and the interactions between acquired injuries and neurodegeneration. She's been the winner of multiple prestigious recognitions. To name just a few, she was elected to the National Academy of Medicine. She's received the Service of America Award. She's been named one of the 100 most influential people in the world and was on the Time magazine's list of 50 most influential people in healthcare. Welcome, Dr. McKee, and we are very excited to have you with us today.
Well, thank you. I'm glad to be here.
So before we dive into your amazing work, I wanted to take a moment for you to tell our listeners a little bit about your background. I understand you're originally from Wisconsin and grew up as a big Green Bay Packers fan. Is that right?
That's right. Yeah. I grew up in a family that played football. My brothers, my dad, they even had me playing as a kid. So, and of course, we lived in a town that was, obsessed with the Green Bay Packers. So I grew up loving football.
So would you define for our listeners what is chronic traumatic encephalopathy and how is it diagnosed?
So chronic traumatic encephalopathy, or CTE, it's a neurodegenerative disease. And it's tau based, meaning that the abnormal protein that builds up in the brain is called tau. And it's caused by repetitive hits to the head. That's the only known cause of CTE. It starts out as just small spots of abnormality in the brain, and it can be found in very young people, like 17, 18 years old. And then it gets gradually worse, even though the person may not be exposed to any more head trauma. It gets worse with aging. And eventually it causes problems with mood, like depression and irritability and changes in behavior and like paranoia or impulsivity, aggression. And then in its late stages, it's associated with dementia. So it's a devastating disease overall.
And how did these CTE pathologies first come across your world? What was the first case you diagnosed and made you realize this work needed a lot more attention?
So I had been thinking that my career would be really focused on Alzheimer's disease and especially diseases of tau. There's many neurodegenerations that have a buildup of tau. Alzheimer's disease has tau as well. And I thought, that was going to be my career focus. I was quite content. But one day we had a person who was diagnosed with Alzheimer's disease come into the brain bank. And when I looked at his brain, he had the most extraordinary pathology I'd ever seen. It was tau, but it was just doing these patterns, and it involved these areas of the brain that just are not involved in other diseases. And then learning that he was a boxer, I became really interested. It was fascinating from a scientific standpoint because I'd never seen this type of degeneration, this pattern of pathology. So that was scientifically fascinating to me. And I tried to get more examples of boxers, and I got a couple, but it wasn't until about 5 years after that that I had the opportunity. I think it was luck or coincidence, but I happened to meet Chris Nowinski, who was interested in the brains of football players, and I was immediately intrigued. And he was the one that wanted me to look at football players if he was able to recruit brain donors from that world. And So that's how it started. And my first case in a football player was absolutely shocking to me. I had been watching football all my life, ardent fan, and I was really surprised to see in the brains of these football players that they had, these just terrific effects of brain trauma. As a neurologist, I had no idea. They look invincible, they have helmets, they don't experience pain or injury on the field for the most part. But then, over time, this disease is, they're at tremendous risk for this disease, which is a devastating disease. And so I started a brain bank for athletes, and that was in 2000. And now in 2025, we have over 1,600 brains. So it's, we've gone
Wow.
from zero to, 1,000. My team, it was really just me and another, a research assistant back almost 20 years ago, well, 2008, and now we have a team of about 60 people, and the brains are just, constantly coming in, and it's just been a wild ride, really, following this disease.
So I want to come back to that, but I want to talk a little bit about just what causes that CTE. So, because you say you don't have to be, it doesn't have to be a concussion level impact hit to cause CTE, because it's not just the impact that matters, but the number of hits in the period of time that is also important. So the non-concussion hits are also crucial. So could you explain to our listeners the mechanics behind the impact that leads to the brain injury that causes CTE, and what exactly is getting damaged?
Okay, so the injury that causes CTE is what we call repetitive head impacts. And what that is a blow to the head, the face, the neck, the body that causes sudden acceleration, deceleration of the brain and rotation. So it's a linear acceleration, deceleration, as well as rotation of the brain inside the skull. And so the brain is not capable of compression, but with these tremendous physical forces, it elongates, it stretches. And as the brain stretches, so do the elements inside the brain, like the nerve cells with their very long processes and the blood
Mhm.
vessels. And that stretch and physical deformation is what causes the injury. So that's the injury inside the brain. Concussion is one of these blows to the head or face or body that causes symptoms. And it's a whole litany of symptoms like lack of balance, confusion, fogginess, all sorts of things. But a concussion is just a repetitive head impact that is symptomatic. It produces symptoms. A non-concussive impact is the same type of injury without symptoms. Turns out that many, many more non-concussive impacts occur during the course of a single season of football than concussions. And what's also important to understand is it's not just the more severe hits, it's not the harder hits that cause concussion, whereas the non-concussive blows are of lesser magnitude. Many of the hits that don't cause symptoms are of equal or higher force than the concussive hits. It's just, maybe the nature of the blow or where the
Mm.
body was or head in space, what area of the head was hit. But the symptom, the only difference between concussion and non-concussive hit is the symptoms. It's not the force of the blow. It's not the type of blow. It's just whether or not there's symptoms.
So I want to take a moment for our listeners to just summarize what you just said, because it's when I heard some of what you just said now that actually really caught my attention and made me stop and just listen more to what you were saying. So based on what you just described, that it's the acceleration and sudden deceleration of the brain and the rotations and the impact that result in damage, we can say that the helmets that are used, for example, in the American football players, are not going to offer the protection needed to prevent CTE. So I wanted to make that clear, because I think a lot of people say, well, they're wearing helmets, so it's okay. But it's not about wearing the helmet, although the helmet does protect the skull from damage and can provide some protection in alleviating the impact of the hits, especially with the new technology. Is that correct?
It can slow down the hit, and it can make, it can make the
Mm.
force, it can slightly diminish the force. But if you think about it, a helmet is really, or the skull is actually nature's helmet, right? And
Yeah,
it's inside the skull that's, there is a bit of fluid in there. The brain is tethered, but it's moving inside the skull. And so you're exactly right. The helmet prevents skull fractures, fractures of the skull, but it doesn't prevent the movement inside the skull from happening. And that's where the damage is coming from.
that's what causes the tearing or the bleeding or whatever it is, the whatever that damage
The
that's.
physical injury to the brain, just the stretch and the
Mm.
destruction, the injury to the tissue elements inside the brain.
Wow. Wow. Interesting. So when you did all this post-mortem work of dissecting all of these brains of multiple football athletes, and you found that there was this correlation with CTE, then if I understood correctly from my readings, you found yourself having to confront the NFL. Can you share with us what that was experience was like?
Well, I'll tell you, I was invited to present my findings very early on,
Mm-hmm.
2009, in fact, uh, to the NFL mild TBI committee. And I did that
Yeah.
twice. And so at that time, we only had a handful of cases. We didn't have a publication, a peer-reviewed publication, which is how you get your science to be accepted by other scientists. We hadn't got it. I wanted to make sure that we had enough cases that we were clear about what we were reporting, and just a just a few cases that could be just a coincidence. So at
Uh-huh.
that time, I think we had like 10 or 12 cases. It wasn't that many. And I did go to the MBTBI committee and present what we had. And it was a closed room in the NFL building in New York. And, in one of the high rooms. And it was mostly men. I think there was one other woman there. It was a very testosterone filled atmosphere. They treated me, I'd say, pretty poorly. I was basically humiliated. They listened to me and then scoffed at the science or what I was suggesting, and it was, they just dismissed it outright. And it was, I wasn't 100% shocked by this. I've been a woman in medicine
Right.
for a long time, and I've been diminished or denigrated fairly often. That's just the nature of the business. But it was a total dismissal, and sort of like, we need a real doctor in here to tell us what's going on.
Wow. So now that you've published many peer-reviewed pieces of work in various journals, has the NFL ever apologized for their aggression towards and dismissal of your work?
Well, no, of course not. But they did at one point, I forgot which year it was now. At one point, they did admit that there was a link between playing football and risk for CTE. And that was considered a huge admission that there was an actual association between the two. Since then, they've sort of backed off of that. They seen the line that there is no clear evidence that the play of football causes CTE.
Oh,
That's
wow.
sort
Is
of
that their current? That's their
as far as I
current?
understand it. I have very little to do with I mean, I don't speak with any representatives from the NFL anymore.
Yeah.
That went by the wayside many years ago. Uh, and, so as far as I understand it, they are distancing themselves as much as possible from CTE. And that's the way the NHL views it as well. There's no clear evidence that the play of hockey is associated with CTE. So that's sort of how they've positioned themselves.
What was your most emotionally challenging case?
Emotionally challenging? Well,
Yeah.
that's an interesting question. I actually think many of them are very emotionally challenging.
Yeah, I
And
can imagine.
I mean, so as a mother, certainly the individuals that are in their teens and early 20s that have only played amateur sports, and you're talking to the grieving parents, or the sister or brother, and those feel so unnecessary. Those deaths
Yeah.
seem so preventable, which of course they are. And the fact that we're now 16 years in, and really we're not getting any movement towards changing the risks that these young people are taking. I mean, that's pretty discouraging, and it can be very frustrating. But what happens is, these cases come in nearly every day, right? We've got, we get lots of cases
You get
in.
teenage cases, like high
Sure,
school.
we do. Sure, sure. We actually published a paper about that about a year ago, where we published our experience of brain donors who hadn't reached their 30th birthday by the time they died. So at that time, which was last year, we had 152 young brain
Wow.
donors. And when we looked at their brains, 41.4% of them had CTE. Now, most of those were early or mild CTE, but still, when you think about it, 20 somethings with a neurodegenerative disease, before I started this work, I never would have thought it possible. It just blows your mind. And the fact
Yeah.
that this is amateur sports that are encouraged by a lot of educational institutions, that, and parents are still putting their kids in these sports at ages 5 and 6, so that by the time they finish high school, they have a decade or more of exposure. This is going on, and there's been no attempt really to lessen the risk for our kids. And that's what I find
Wow.
so unbelievable about this work. I hear the argument that these are professionals, they're grown people that are making their mature decision, that there's a lot of rewards with these sports, and they're choosing, the potential for lots of money, and that's the risk they've decided to take. But that's not what our kids are doing playing these sports in school. That's not what I think most parents want for their children, for
Yeah.
them to suffer brain injury in pursuit of these sports. Quite a high risk, if you ask me. That's probably, I would think, most parents' nightmare, to give your kid brain damage. But that's what's going on. And we, as a nation, continue to deny this risk. We continue to pretend that it's not happening, or that it's been dealt with. It hasn't been dealt with. It's just continuing.
Wow. And I just want to make sure our listeners are aware, this is a post-mortem diagnosis. That is what makes this very sad. We're not talking about, just putting someone on an MRI scanner and saying, oh, you have CTE. Every time you say that you diagnose somebody that was under 30, under 20, whatever, of having CTE, we're talking about someone who has passed away and you had the brain donated and you looked at the postmortem diagnosis, basically. That's what
Yeah,
makes it very
that's
sad.
true. And a lot of
Yeah.
times these young people know there's something wrong. And the parents will say, we noticed a change. We noticed I mean, it's mostly men. We've had a couple women diagnosed that were athletes. A lot of that is because we don't have a lot of women brain donors. We need more women brain donors. But parents will say, he changed. We saw a change. And the individual themselves will say, I something's going on, I can't control it, that my head just, I have these urges or impulses, I have these racing thoughts, and I can't stop them. And so, there needs to be more awareness that these kids are
Yes.
suffering when they come in and see somebody and they have symptoms like this. It's important to get a history of how much contact sport play they've had, and to consider that this might be happening. Even if these young people try to approach a medical professional, a lot of times, they're poo-pooed. There's sort of passed off as
Dismissed.
yeah. And this is real. This is a real disease. This is really affecting some of our young adults, and they need to be validated, right? They need validation that something's going on. We can help them. We can help treat their symptoms of depression and anxiety, and, the various sleep disorders, we can help them. And having someone just take them seriously is also very comforting. There's a comfort in that and a validation that you're just not going on, this isn't all you and willful behavior. This is a disease and we can help you cope with it. Just that validation would go a long way towards comforting people that are suffering from this disease.
Yeah. So I want
And I
to
will
ask
also
you.
say, I just want to interject.
Mhm.
We can't diagnose this disease with certainty until after death, but we are working very hard on what we call biomarkers to diagnose this disease, either a blood test or a spinal fluid test, or maybe a special type of imaging. And we are getting a lot closer. I mean, the whole reason I run
Yeah.
a brain bank is so that we can learn from the people who have passed and then help the people who are living. And we've learned tremendously from the brain bank tissue, but now we really want to apply it to the living.
Right. And so I want to get back to that because I have some questions on that. I wanted to read some excerpts from one of your scientific publications just because it speaks to the broadness of this. And in April 3rd, you published something called the Chronic Traumatic Encephalopathy Criteria for Neuropathological Diagnosis and Relationship to Repetitive Head Impacts, where you write, CTE has been reported in amateur and professional athletes, including a bull rider, boxers, wrestlers, and American, Canadian, and Australian rules football, rugby union, rugby league, soccer, and ice hockey players. And then in 2018, you write in the neuropathology of chronic traumatic encephalopathy, and you write, again, CTE was first recognized in boxers almost a century ago and has been identified more recently in contact sports athletes, military veterans exposed to blast, and victims of domestic violence. I think in these publications, you can see that it reaches beyond American football. I'm guessing for soccer, the concern is the headbutts, and hockey, the constant clashing and maybe the punching and the fighting that goes on. Separately, did you present those findings also to, you said NHL, but also to FIFA?
Oh, yes, I presented
Or
them in Zurich.
was
I
it
think
better
it
reception?
was pretty bad reception. Yeah, it was terrible.
Really? From, interesting. I think I mean, one thing is not to know, another thing is not to want to know.
Yeah. Well, they don't want to know. The major sports leagues don't want to know, and they have gone to extremes to, I think, they're either deny the science or obfuscate the science to make it sound like all the scientists disagree. And if they could only agree, then we might take it seriously. But the truth is, they just come up with, you answer one argument and they come up with 12 more. There's just a desire to make this confusing and make this less clear when actually the data is there and it's very well substantiated in the literature.
Yeah, I think there's a robust amounts of literature indicating the existence of CTE and the correlation with some of these contact sports. I'm curious, what interdisciplinary collaborations do you think would be essential for advancing the CTE research?
Well, I think we're doing a lot of them. We work with many centers in the US,
Mhm.
so we're trying to get, broad representation from all over the US. And there's multiple centers that are doing work. Obviously, we need clinicians looking at people, evaluating people, following them long term. We need to look at young athletes as they play these amateur sports and follow them over time, to determine what is the long term trajectory of some of these sports. We need imaging neuroradiologists to follow them with brain scans. We need geneticists to look at whether or not there's a genetic predisposition to
Mhm.
these diseases. And of course, there will be. We have some inklings. We know ApoE4. If you have inherit that allele, ApoE4, you'll have more
Yeah.
severe CTE. and more dementia. We have one allele that is slightly protective, but of course, there's probably many, many more genes involved in susceptibility and risk for CTE. We need basic scientists to understand the mechanisms. So we want to always be thinking of treatments. We know there's tremendous inflammation in the brain after you get your head hit, and maybe being able to quiet down that inflammation, that will be preventative for CTE. We know there's vascular injury. The small blood vessels in the brain get injured by these hits, and maybe, sealing up those small blood vessels, making them less leaky, will help prevent the disease. So there's lots of avenues. There's lots of people that need to be involved.
Yeah.
Not just neuropathologists after the fact, like myself, although we have a lot to offer in terms of understanding how this disease occurs.
Yeah, yeah. So I wanted to go back to something you said before on the biomarkers. I saw that in one of your publications, you talked about inflammatory cytokines were elevated in the brain tissue and cerebrospinal fluid of athletes with CTE. So there is potential for perhaps some blood biomarkers to be developed within, hopefully sometime in the near future. Is that the case?
Yeah, no, it's absolutely true. So we've had many studies looking at the different inflammatory proteins that are high in CTE versus controls. And we're,
Hmm.
of course, looking for those same markers in spinal fluid and blood. It's probably not going to just be one marker, it's probably going to be a number of different markers. And we have had success, but usually on a group level, meaning if we have group all the people with suspected CTE against the controls, we might see some significant increases, but they're not sensitive and specific enough to be able to make the diagnosis for a single person. What you want is a test or a set of tests that say, when a person comes into the clinic and you do the test, you
Hmm.
say, aha, you're at, this is, these results make it probable that you have this disease. We're not at that very sensitive, specific point yet.
And so I always feel that before we say we want to have some information, it's important to give some thought to what do we do with the information once we have it, right? So if there were a reliable biomarker, what are some concrete steps that could be taken to, I don't know if we can reverse it, but prevent more damage other than the obvious step of stop or reduce playtime, right?
Right, right. Well, if it looked like you were headed, if the biomarkers suggest that you have injury to the brain, that you may on the be on developing
Right.
CTE. I mean, the person could make a decision about whether or not they want to keep playing and perhaps accelerating that path. That would be an individual decision. The biomarker would be very helpful in terms of clinical trials. We can't test out any potential treatments until we have a way to monitor the disease to see if it's efficacious, to see if the treatment is efficacious. We have to follow the biomarker, see if it improves or gets worse in order to get information about the efficacy of the therapy. There are potential therapies out there. There are anti-tau clinical trials
Mhm.
in other diseases, but we can't do it in CTE because we have no way to follow the disease. And so that's one thing. We could look at drugs that might lower and maybe lessen the clinical symptoms associated with CTE. But we could also look at anti-inflammatory treatments or really quite a broad swath of other potential treatments. There's some vascular drugs that might be efficacious, but we can't really take a hard look at any of these without having a way to measure whether it's successful or not.
Is it reversible? It's not reversible, is it?
Well, it's hard to say. I mean, it's potentially reversible or it might be partially reversible. It's not, in the brain, we see a lot of changes that occur before the development of the tau protein. So,
Mm.
certainly in that pre-tau phase, I think it is potentially reversible or preventable. Once you get the tau deposition in the brain and nerve cells start dying and you start losing connections between cells, then you get into more irreversible territory, but it's still possible to slow the disease down or maybe stop it from getting worse.
Yeah, I would think especially if the person is under 25, right? before they're completely even developed with their brain
Yes. And then
functionality.
there's the other added element that I don't think we should minimize. These people feel like they're going out of their mind. They feel like they just can't get their finger on this. And believe it or not, even just knowing that this is a possibility is reassuring. Believe it or not, just having a
Right.
label is often
Yes.
reassuring to people and comforting that, their symptoms are being taken seriously and that there's an effort to try to make them feel better. That is there are a lot of diseases that we don't have great treatments for, and somehow just knowing what the disease is, having the care and management of that disease, and understanding more about what it is, there is an element of comfort there.
Yeah. In other words, you're not just doing this because you want to, you're doing it because your brain is not allowing you not to.
Yeah, it just, I've noticed that even the brain donor families. I mean,
Hmm.
the sense of relief, knowing the diagnosis, I really can't understate how important that is to families. Knowing that it wasn't willful, that it wasn't purposeful, it wasn't they hadn't developed these very often unpleasant symptoms like anger, aggression, hostility, impulsivity, depression. It wasn't just them. It was pathology that they couldn't master.
Yeah, yeah. So I wanted to ask you something a little bit different. So I found it very interesting that I was able to learn about all of these famous athletes that had CTE from your work. And I'm wondering, how do you balance the need for scientific advancement with the privacy rights of these individuals, the ones involved in the studies?
Well, we don't release the names of anyone. That's
Hmm.
we do not. We everything is confidential. Everything is very private. We consider this a great honor to be, part of their medical journey. But when these athletes are have a story in the press and
Hmm.
their names are announced, that is because the family chose and wanted to do that. Um,
I
that
see.
that is not, and we support it. We will support their wishes. If they want us to talk to a reporter about their specific case, I'm happy to do that. But I'll never do that without the family making that decision entirely by themselves.
Yeah. Yeah. I mean, in a way, I find that, and this is one of the questions I had for you, but in a way, I find that knowing, especially if it's somebody who's well known, helps to create awareness, right? Um,
No question. Absolutely. And I think that's what happens. These families are generally devastated. Okay.
I'm
It doesn't,
sure.
it doesn't matter who it is. These families are devastated, and it's very common for them to want, now that they've been sort of, hit over the head
Head.
with this diagnosis, they want people to know because it's surprising to them and it's devastating. They want people to realize that this is real. And so they go to great efforts to make, to bang the drum, to
Mhm.
make people see it. And I think having a face, and people can relate to it, it makes a huge difference. And I think over the last, we're starting on 17 years, we have seen a big swing in public awareness. And I think a lot of that is due to families wanting to go forward and be public.
Right. So I'm curious, what are your thoughts on how to better educate the public about CTE to, sort of improve and protect the younger at-risk population?
Well, I think a lot of education can be done through coaches and players and, educational institutions. I think there probably needs to be more education about what CT is. There's a lot of noise out there, some of it induced by bodies, individuals, or businesses that are affected by CTE,
Yeah.
so there's a lot of noise. And if you listen to the noise, you think that CTE is all done, everyone's solved the problem. It couldn't be farther from the truth. But so we really need to start educating the public. And I think maybe the best place is in our educational institutions, starting with the coaches and players. Once they understand more about this, how these repetitive hits to the head can be very damaging, we need to start reducing those hits. And that can be done with changes in the rules of play of certain sports, starting playing at a later age just to reduce their career, and designing rules so that there's less hitting of the head. And that can be done more easily in some sports than others. But, we have to really make a concerted effort to try to reduce the number of head impacts in these sports. And I think, the more we understand about this, the greater the change will be.
Yeah. So if you could implement two policy changes in contact sports that would have to be followed, what would they be?
I'm not a policymaker, I'm a
Mhm.
scientist. And I understand that we need to reduce the head hits in football. I can't give you some policy ideas right now. I mean, it's obvious we need to change the rules of play. We need to change awareness and education. Those are the policy changes I would make: greater education and awareness. And then the public will demand further rule changes and changes to the way these sports are played. But you have to remember, I'm a scientist, and my job
Yes.
every day is to talk to families to understand what's going on in their loved ones' brains, and to publish papers about the science and pathogenesis of this. So I can't wear the second hat. I can't be the policymaker.
Right. No, I, I, I think the work that you have done in terms of just defining how we look at CTE, or just sort of putting a blueprint out there for other scientists to follow and agree on, or discuss, or even come to conclusion with you on, how to define that this is CTE versus maybe, as you said, some other disease, and that it's truly a unique disease is the most important part, right? So you can't sort of say, oh, I don't know, Alzheimer's, it's not CTE. The clarity that CTE is its own disease, I think is really important. And you've
Yes.
showing that these brains have this one disease, this particular disease, I think is really, really important.
Yes. And also, it's a disease that can start extremely early. It's not
Mm.
just a professional athlete. It's also people that get their head hit because of poorly controlled epilepsy, because of falls, frequent falls. It would have to be quite a lot of falls, but it's frequent falls. It can be in people that are assaulted or get physical abuse. So, it's not just athletes, it's in our military, not just the blast exposures, but all the military related activities. Also, we've seen so it's anyone whose head is hit. And that's what we want to make people more aware of. And it can
Right.
start very early in life. And I think that's a message I really need to get across to people.
Yeah. That's very surprising. That was one of the things I found most shocking when I was reading some of your publications, was how early on, because usually when you talk about tau, I'm thinking, something like Alzheimer's or something a little bit more
Right,
later in life.
right,
Um,
right. Me too. That's what I thought. And then I saw the brain of an 18-year-old. That was back in 2000
what,
and
18?
well, 18, yeah, the youngest it's ever been described in is 17. At least, but we've seen quite severe CTE in 18-year-olds who only played high school football. I mean, you don't have to play even at the college level to get this disease. So something needs to be done. And what we need to do is reduce the risk for this disease by reducing the number of hits experienced by these athletes. That's the bottom line.
We're coming to the hour and I need to wrap up. And we have a tradition on the podcast where we ask our guests to provide listeners with actionable advice that they can do today or tomorrow. So the question for you is, for parents who have children and may not even know what CTE is, and perhaps they're listening or hear somebody who listened and have children in these contact sports, be it football, hockey, soccer, wrestling, whichever sport, and they want to protect them from developing CTE, what advice would you give them?
Well, I would delay my kids' participation in contact sports that are associated with hits to the head, and that means football, rugby, soccer, unfortunately. Ice hockey, I would delay it as long as possible. There's a lot of sports that can be played that don't risk hits to the head, and I would delay the onset, your child's entry into a sport with hits to the head, as long as possible. I would also urge every parent to make sure that the coaches are well versed in what CTE is and ways to reduce their kids' head contact during the play of the sport. You know, there's a lot of creative coaches out there, and there are techniques that can lower the amounts of hits to the head, and that can be done. The parents will need to do a little bit of homework. Personally, I would suggest that the parents emphasize sports that don't have any contact to the head, because I would think that most parents want to have their kids have the greatest potential for brilliance throughout their life. And if they're injured, if their brain is injured, it's not going to have the same potential. So a lot of it is, you know, in their individual community, what is the level of awareness and education from coaches? And, you know, the parents can make decisions about what sports to direct their kids to. I would certainly advise no head contact before adolescence. I wouldn't be putting my kids in football at the age of 6. I would really urge them not to put them in football until they were physically more mature, like even in high school. So, you know, that's the basic advice.
And on that note, I want to thank you again for being with us today and for sharing your insights. But most importantly, I want to thank you as a mother for what you're doing.
Well, thank you, and I
And
appreciate
for
it.
and for all our listeners, thank you for tuning in, and we will see you next time.
Great.
As we close, I want to thank you for joining me on the Her Notebook podcast. I hope today's conversation brought you some knowledge and sparked new insights. If you enjoyed this episode, I humbly ask that you please remember to click the subscribe button below. Until next time, keep flipping your notebook pages and embrace the journey to a healthier, happier you. See you next week.